Hello, my name is Shauna. I'm a first year PhD student at UNLV School of Nursing, and I'll be presenting my article critique on grounded theory. The article I selected is called Moving from Uncertainty Toward Acceptance, a Grounded Theory Study on Exploring Iranian Women's Experience of Encountering Menopause. The research purpose and question. So the question is, what is the Iranian women's experience of encountering menopause? And really, it was to help us understand better what they go through when they're encountering this change in their life. So to summarize the article, the researchers used a grounded theory approach. 27 women from 42 to 55 years old were interviewed over the span of 3 years. Each interview lasted about 45 to 85 minutes, and they were semi-structured, in-depth interviews. They were recorded electronically, conducted by a female author, and then transcribed verbatim, and then analyzed. So the analysis was completed, using constant comparison and then true to ground theory model, open, axial, and selective coding, which led to 564 codes, 10 subcategories, and 5 main categories. The core category was moving from uncertainty toward acceptance, and the interrelated categories selected were challenging age, observing symptoms of menopause, responding to the menopausal symptoms, understanding the need for preparation, and assessing the right time to prepare. Numerous quotes were included, so it really did give the article depth from the participants. And when they did compare their themes to other literature, they used qualitative studies for comparison, and a lot of the themes were very similar, so it kind of gave a lot of richness to that. As far as their methods that they used, as we mentioned, the 27 women were selected purposefully and theoretically from Mashhad and Ghanabad, northeast of Iran. Semi-structured in-depth interviews, as I mentioned, were conducted until saturation was achieved, and all of them were recorded electronically and transcribed. They used the analysis of Strauss and Coben's method through open, axial, and selective coding, and they actually used the data software as well to help organize the data and categories. And, the results were that, as we mentioned, the core category was moving from uncertainty toward acceptance, and the interrelated categories that we mentioned as we mentioned before, really focusing on the observing the symptoms, responding to the symptoms, understanding the need for preparation, and assessing when is it time to prepare. So how can this study be used? Really, it's going to help us understand the knowledge and information about menopause actually helps them experience the transition easier, because what they found was that women who had more education, whether it was through social networks, their providers, books, things like that, they actually embraced the transition in a more positive light. And they weren't afraid to age. They knew what to expect, so they overall had a positive view from it. And so, if we can modify people's beliefs about aging and menopause, it might be able to help women's experience that transition a little bit easier, essentially. And as far as the strengths of this article, again, they stayed very true to the ground theory model. So you'll see here in the left bottom corner, these are some of the things that you're looking for in a ground theory model. Was it fit, applicable? Were there concepts, contextualization of the concepts, logic, depth, variation, creativity, sensitivity, and evidence of memos? They used all of that, and they talk about it greatly in their study. So they really do convey how much they tried to stick true to the theory. And as again, in the data analysis, they stay true with the category creation, things like that, and they used Guba and Lincoln's components of research to demonstrate trustworthiness. And the sample the women were collected from health centers that they were referred not for menopause symptoms, so they were not trying to be biased about that at all. They were actually just looking for women who were there for the midlife checkup. And they really did stay ethical. They requested informed consent for every interview. As far as the limitations, sampling, they didn't use a maximum variation strategy, which is usually what they want for the ground theory model. It wasn't exactly generalizable, I guess, to every woman, because this was more particular to Iranian women. And as far as being generalized to Iranian women, only two small regions were sampled from. So the authors recognized that they would need a more variety of regions to be able to be generalized to Iran. The interviewer, there was no real information given regarding of like the training of that they've had in interviewing. Were they a novice or not? Nothing was really discussed that way. So in conclusion, the study, concluded that, education and information is really required, and it's going to help a lot of women have less negative beliefs about menopause, and it can help them move towards acceptance easier. And all over and all, I think as far as a ground theory model, this was a great example of it. They explained their methods throughout. The information was cohesively communicated. It was very rich with quotes and from the participants. And I think what was really great too was to see the comparison in the literature from qualitative to qualitative, and the themes that kept emerging from studies around the world. So, and their suggestions for implications were very clear. So overall, I think this was a great example. And here are my references. Thank you so much.